in the summer of 2016 when I came across research papers that showed, hey, when you put a team in primary care that includes therapists and psychiatrists, and you put a system around that, which is actually screening everybody to get care, when you identify people with depression or anxiety, be able to make warm handoffs, which is just a fancy way of saying an introduction that feels more personable. Not, hey, Spencer, you're depressed, you should think about seeing a therapist, but hey, Spencer, sounds like you're struggling a lot with your sleep or your nerves. Would it be all right if one of my colleagues, Virna, calls you? She's got helps me care for my patients, a lot of patients going through the same thing, and she can check in with you in between our visits. And Virna and I collaborate really closely to make sure you're getting better. That sounds a lot better. And not only does it make sense, and that in this role, Virna is one of our what we call our behavioral care managers, of which we now have a couple hundred of. And then checking in with patients on video or phone visits, sometimes in person, in order to be able to do a spectrum of interventions, therapy, goal setting, but always anchored to monitoring symptoms to find out if you're getting better or not, really tracking not just do you like your therapist, not just do you feel good, not just are you picking up the phone, not just can we bill you, but are your symptoms getting better? Are you healthier? Are you happier in your life? And using that to really titrate the interventions, both on the talk therapy side and then through a weekly consultation with a psychiatrist to help that primary care physician make decisions on diagnosis or medication. And that it makes so much sense. And you go, man, I wish I got that care. I wish my family, the people I loved, got it. And like everybody, I'd, not only been an innovator in healthcare, but had been a patient and a consumer of it. And, you'd seen how transformative great behavioral health care can be and how hard it is not to get it in this country, right? And how rarely it connects with everything going else in your body. So it not only made sense, but there was something like 80 randomized control studies that have been done that showed the outcomes were better, right? Better than primary care acting by themselves. Frankly, normally better than therapists acting by themselves, better than outpatient behavioral health interventions. And oftentimes the interventions can, pay for themselves by avoiding higher cost care down the line. And it was just one of those moments when you're kind of like, well, why doesn't this exist yet? Right? Why this has been happening for decades. And I started to ask everybody I knew, and it was interesting. There's two reasons. One, which is so common in healthcare. One, the money didn't work right, and two, it's kind of hard to do it well, right? To put this team together and make it all happen. And it was about that time that I was getting fascinated by this, that we got word that Medicare was going to finally make this team model of care a covered benefit. And it said, oh my God, that is amazing. Doctors across the country are going to love this. But if we ask every primary care physician to figure this out herself, it'll probably take 30 years and a lot of them will mess it up. And so that's when the lights started going off that it would be, this could be an opportunity for someone to start something new. I knew that me personally was only part of the founding team, right? So I started asking everybody that I had met who was the best person in the country to do that with. And a bunch of folks gave me Virna's name, and one was silly enough to give me her cell phone number. So I called her out of the blue, thinking that I had some interesting information, which was Medicare was about to make a change. And she had known that because she was on the advisory group that had been yelling at them to do this for 7 years. She was like late to the game, but it had the same job for 15 years and kids in college and all these reasons why startups seemed like a totally different world. And I caused her to make a set of bad decisions in a row, starting with picking up the phone call and then agreeing if I flew to New York later that week that she'd carve an afternoon out for us, and then asked her to work nights and weekends for a while as we were figuring this out, and that she was kind of being an advisor to it right at the beginning, and then got enough traction that she finally had to jump with me and make it a full-time job as we grew and scaled across what's now 9 states and several hundred employees.